Have you ever wondered what happens to your body and mind as you get older, especially when it comes to intimate matters that nobody wants to talk about? If you're above 60 years old, this topic might hit close to home for you. I am Dr. Natalie Teo, and I have been practicing medicine here in Singapore for more than 30 years now. Today, I want to have a heart-to-heart talk with you about something that many of us shy away from discussing, especially in our Asian culture, where such topics are often considered taboo or pantang to bring up openly. You see, throughout my career working with patients at various polyclinics and hospitals across Singapore, from Tan Tock Seng to SGH, I have encountered countless elderly men who struggle silently with questions about their changing bodies and sexuality. They come to me looking worried, sometimes even ashamed, because they do not know who else to turn to. Their children are too busy with work and their own families. Their wives, if still around, might not understand, and talking to friends at the kopitiam about such personal matters, alamak, that one very paiseh lah. So today, I want to address this openly and honestly as your doctor and as someone who genuinely cares about your well-being. We are going to talk about the changes that happen to male sexuality after the age of 60, including topics like self-pleasure and intimacy that our society often sweeps under the carpet. And this content is meant for adults, particularly those of you who are already in the golden years of your life. Whether you are a retiree enjoying your time at the void deck or still keeping active with morning exercises at East Coast Park, this conversation is for you. Let me start by explaining what naturally happens to our bodies as we age. You see, when men reach their 60s and beyond, the body goes through a series of changes that are completely normal. Your hormone levels, particularly testosterone, begin to decline gradually. This is not something to be alarmed about. It is simply part of the natural aging process, just like how your hair turns grey or your eyesight becomes less sharp. For many years, I have seen patients who come in panicking, thinking something is terribly wrong with them. But I always tell them, Uncle, this one normal lah, your body is just adjusting. Now, one thing I want to address directly is the matter of sexual activity and self-pleasure in older adults. In Singapore, we do not really talk about these things openly. Many of you grew up in a generation where discussing anything related to sexuality was considered improper or even sinful. Your parents never talked about it, and neither did your teachers. But as a medical professional, I believe it is important for you to have accurate information so that you can take care of your health properly. Self-stimulation, or masturbation as it is medically called, is a natural human activity that does not stop just because you have reached a certain age. In fact, for many elderly individuals, it can be a way to maintain connection with their own bodies during a time when physical intimacy with a partner might be less frequent or no longer possible. Some of you may have lost your spouses, some may have partners who are unwell, and some may simply find that the dynamics of your intimate relationships have changed over the years. What does the medical research tell us about this practice in older adults? Let me share with you what I have learned from both my clinical experience and the scientific literature. When practiced in moderation, self-pleasure can actually have several benefits for elderly men. First, it helps to maintain blood circulation in the genital area. You know how they always say use it or lose it? There is actually some truth to that. Regular stimulation can help prevent tissue atrophy, which is when the tissues become weaker from lack of use. Second, and this one many people do not know about, the act of reaching climax releases endorphins in your brain. These are the same feel-good hormones that you get from exercising or eating your favorite char kwai tao. Endorphins help to reduce stress, improve your mood, and can even help you sleep better at night. I have had patients tell me that they used to have trouble sleeping, tossing and turning until 2 or 3 in the morning. But after we discussed healthy approaches to managing their stress and physical needs, their sleep improved significantly. Third, from a psychological perspective, maintaining some form of sexual activity can boost your self-esteem and body image. As we get older, it is common to feel like we are losing control over our bodies. Things do not work the way they used to. You cannot climb stairs as easily, you cannot eat as much without your stomach protesting, and you might feel like your body is betraying you. In this context, being able to experience pleasure can be a way of reclaiming some of that control and feeling more connected to yourself. However, and this is very important, I must also talk about the other side of the coin. Like anything in life, too much of a good thing can become problematic. In my 30 over years of practice, I have seen cases where what started as a normal healthy practice became excessive or compulsive. When this happens, it can lead to several issues that you should be aware of. Physically, overstimulation can cause sensitivity issues. The nerves in your genital area can become desensitized if they are stimulated too frequently or too intensely. This can lead to a situation where you need more and more stimulation to achieve the same level of pleasure, which can be frustrating and sometimes even painful. Some patients have come to me complaining of discomfort or numbness, and when we trace back the cause, it often relates to excessive frequency. But the physical concerns are actually not the biggest worry. What concerns me more as a doctor is the emotional and psychological impact. You see, many elderly people in Singapore face loneliness. This is a real problem in our society. Your children are busy with their careers. Maybe they have moved to their own HDB flats or condos. Your old kakis might have passed on or become too unwell to meet up regularly. The community bonds that used to be so strong in the kampung days have weakened in our modern high-rise living environment. In this context of loneliness and isolation, some people turn to self-pleasure as a form of emotional escape. It becomes not just about physical relief, but about feeling an emotional void. And when this happens, it can actually make the loneliness worse in the long run. Instead of reaching out to family, joining community activities at the RC, or seeking companionship, the person withdraws further into themselves. I have seen this pattern many times and it is heartbreaking. Let me tell you about a patient I had some years back. I will call him Mr. Tan to protect his privacy. Mr. Tan was in his late 60s, a retired civil servant, widower. His wife had passed away about 5 years before he came to see me. His 2 children were doing well, one working in banking, one overseas in London. On paper, Mr. Tan had everything: a comfortable retirement, CPF savings, a nice flat in Toa Payoh. But inside, he was struggling. He came to me initially complaining about fatigue and lack of motivation. After several consultations and building up trust, he finally opened up about what was really going on. He had fallen into a pattern of excessive self-pleasure, sometimes multiple times a day, as a way to cope with his grief and loneliness. It gave him temporary relief, a few moments of feeling something other than emptiness, but afterwards the guilt and shame would set in, making him feel even worse. This is what I want all of you to understand. The physical act itself is not the problem. The problem arises when it becomes a substitute for genuine human connection and emotional support. Mr. Tan did not need me to judge him or lecture him about morality. He needed help addressing the underlying issues of grief, loneliness, and depression. We worked together over several months. I referred him to a counselor, encouraged him to join some activities at his local community club, and helped him reconnect with his children. Slowly, things improved for him. Now, I know some of you might be thinking about the religious or moral aspects of this topic. Singapore is a diverse society, and many of you come from backgrounds where religious teachings play an important role in your life. Whether you are Buddhist, Christian, Muslim, Hindu, or follow traditional beliefs, your faith provides guidance on how to live your life. I respect that completely, and I'm not here to tell you that your religious beliefs are wrong. What I will say is this: if you feel conflicted about this topic because of your faith, I encourage you to speak with your religious leaders or counselors. Many religious traditions actually have nuanced views on human sexuality that go beyond simple prohibitions. The key is to find an approach that allows you to be at peace with yourself, both physically and spiritually. What I can tell you from a medical standpoint is that sexual feelings and needs do not simply disappear because you have reached a certain age or because you wish they would go away. For those of you who have partners, whether wife or otherwise, I want to address how individual sexual practices can affect your relationship. This is another topic that people often avoid discussing, but it is important. In a long-term relationship, both partners may experience changes in their desires and capabilities as they age. This is normal. Some couples find that they are more interested in intimacy than their partners, or vice versa. Some find that physical limitations make traditional intercourse difficult or impossible. In these situations, self-pleasure can be either a helpful supplement to couple intimacy or a harmful substitute for it. The difference lies in communication and intention. If you are using it as a way to avoid connecting with your partner, or if it is causing you to lose interest in being intimate with them, then it may be creating distance in your relationship. On the other hand, if it is something that helps you manage differences in desire while maintaining emotional closeness with your partner, it can be part of a healthy relationship. The key is honest communication. I know, talking about these things with your spouse can feel very awkward, especially if you have been married for 40 or 50 years without ever discussing such matters openly. But it is never too late to start. You might be surprised to find that your partner has been having their own concerns and questions that they were too shy to bring up. Let me also address some common myths and misconceptions that I often encounter. First, there is no scientific evidence that self-pleasure causes any permanent damage to your body or accelerates aging. Some people believe old wives' tales about it causing blindness, weakness, or various diseases. These are not supported by medical research. Your body is designed to handle normal sexual activity throughout your life. Second, it does not cause or prevent prostate cancer. I have heard claims on both sides, some people saying it increases risk, others saying it decreases risk. The research on this is actually quite mixed and inconclusive. What we do know is that maintaining overall health through proper diet, regular exercise, not smoking, and managing conditions like diabetes and hypertension is far more important for your prostate health than your masturbation habits. Third, having sexual feelings or desires in old age does not make you a dirty old man or indicate that something is wrong with you. This is perhaps the most damaging myth of all because it causes so much unnecessary shame. Sexuality is a normal part of human life from puberty until death. The way it manifests may change, the intensity may differ, but it does not simply switch off at 60 or 70 or 80. So what is my advice to all of you? First, do not be afraid to discuss these matters with your doctor. We are trained professionals, we have heard everything, and we are not here to judge you. If you have concerns about your sexual health, changes in your body, or your emotional well-being, please bring them up during your medical appointments. If you feel uncomfortable talking to a younger doctor, ask if there is a senior physician you can speak with. At polyclinics and hospitals across Singapore, there are doctors like me who understand the concerns of older patients. Second, pay attention to whether your habits are affecting other areas of your life. Are you withdrawing from social activities? Are you neglecting your health, your hobbies, your relationships? Are you feeling increased guilt, shame, or depression? These could be signs that what started as a normal practice has become problematic, and you may benefit from speaking with a counselor or mental health professional. Third, focus on maintaining overall wellness. Sexual health is just one component of your total well-being. Make sure you are eating well, getting regular exercise appropriate for your age and condition, staying socially connected, and keeping your mind active. Join the exercises at the park, go for walks with friends, participate in community activities. All of these contribute to a healthier, happier life in your golden years. Fourth, if you are in a relationship, make an effort to maintain emotional and physical intimacy with your partner, even if it looks different from when you were younger. Hold hands, hug, cuddle, express affection. Physical closeness does not always have to lead to intercourse. Many couples find that other forms of intimacy become more important as they age, providing comfort and connection that goes beyond sexual gratification. Fifth, be kind to yourself. Many of you have spent your whole lives being hard on yourselves, working tirelessly to provide for your families, sacrificing your own needs for others. Now that you are in your retirement years, give yourself permission to experience pleasure and comfort. Your body has served you well for 6, 7, 8 decades. Treat it with respect and appreciation. I want to end by talking about something that I feel very strongly about, which is the need for better education and open conversation about elderly sexuality in Singapore. For too long, we have treated our senior citizens as if they are beyond such concerns, as if reaching a certain age means you stop being a complete human being with physical and emotional needs. This is not only inaccurate, it is disrespectful. Our pioneer generation and Merdeka generation deserve better. You deserve to have access to accurate health information, supportive medical care, and a society that does not make you feel ashamed for being human. I hope that through conversations like this one, we can start to change the culture and make it easier for elderly Singaporeans to discuss these important aspects of their health. To the younger people who might be watching this, perhaps because you are concerned about an elderly parent or relative, I encourage you to be open-minded and supportive. Fine. Your parents and grandparents may have questions and concerns that they are too embarrassed to voice. Creating a non-judgmental environment where they feel safe to discuss their health needs is one of the most loving things you can do. In conclusion, the changes that happen to male sexuality after 60 are normal and natural. Self-pleasure, when practiced in moderation, can have benefits for physical and emotional health. However, when it becomes excessive or serves as a substitute for human connection, it can be harmful. The key is balance, self-awareness, and not being afraid to seek help when needed. Remember, pleasure has no age limit. What matters is finding a balance that allows you to enjoy your golden years without it becoming a burden or a source of guilt. If you found this discussion helpful, I encourage you to share it with others who might benefit and to follow my channel for more honest conversations about health topics that matter to you. I am Dr. Natalie Teo, and I believe that every Singaporean, regardless of age, deserves to live a healthy, fulfilling life. Take care of yourselves and do not hesitate to reach out to healthcare professionals when you need support. We are here for you. Thank you for listening, and I will see you in the next video.